Hello, and thank you for watching this brief presentation on evidence-based practices. I am Monica Prasad with the Sawaro Evaluation Group, and your presenter today. So what do we refer to when we talk about evidence-based practices? These are techniques, intervention, and prevention models, which include programs that have shown to have positive effects on outcomes through rigorous evaluation. And what does rigorous evaluation mean? Well, it means that these practices have been tested in randomized controlled trials or quasi-experimental trials, and also in one or more studies that have shown positive outcomes. Another characteristic of these practices is that they bring together research, professional expertise, and the input from youth and families. And yes, many people do not know that most, if not all, evidence-based programs require the input from the community, and especially those who will be participating in the programs or interventions. When evidence-based programs are developed, they often need to be adapted to be used with groups of people other than the original target community. So these new groups may differ in race, ethnicity, sexual orientation, culture, religion, or other factors, and researchers have to go through very strict protocols to make adaptations to the programs. And these protocols also require more input from the community that will be using the programs, pilot testing the programs, and that is again through either quasi-experimental or randomized controlled trials, and examining the outcomes of the programs to ensure that they are still effective. So as you see, evidence-based programs have solid foundations, and that is why they are preferred to funding entities. So why should we use evidence-based practices or programs? I think the first point is, why reinvent the wheel when we already have so many programs that are evidence-based and ready to be used with different populations? The most important reason is because youth and families deserve the best prevention and intervention methods available. We are responsible for the programs we deliver and their outcomes, so why not use the best sources available? Another important point is that government grants require the utilization of evidence-based programs, and these requirements are more strict each day, to the point that some of the funders provide a list of their preferred programs, and in order to receive funding, organizations must choose a program from the list. Private foundations are more flexible, but they are catching on the importance of evidence-based programs and practices. The last point is that a grant proposal or an organization's history of using evidence-based practices is viewed as a responsible and thoughtful use of limited resources by government, funders, and others. What requires the use of evidence-based programs? Here are some examples. We have federal government and local government requiring the use of this type of practices. Examples are the Substance Abuse and Mental Health Administration, that we know by SAMHSA, the Department of Education, the Department of Human Health Services, which also funds the teen pregnancy prevention programs. Most nonprofit funders and many public foundations also require the use of evidence-based programs, and here again is a very small sample. Robert Wood Johnson Foundation, the Ford Foundation, the Vitalis Foundation, which is a local Arizona foundation, the Annie E. Casey Foundation, and the Archstone Foundation. So within the hundreds of evidence-based programs that exist, how do we choose the program that is right for our community, the community that is going to be receiving the program or the practice? Well, there are 4 steps. The first one is assess fit with participants. So some questions that you can ask yourself is, have youth similar to potential participants being helped by this program? Are the planned activities socially and developmentally suitable for the potential participants? Are the planned activities culturally and linguistically suitable? Would the target youth enjoy and attend the program? The program also has to fit the organization. So in order to assess the fit with organization, we can ask ourselves some of these questions. Is the program goal compatible with implementing organization's mission? What do board, staff, and leadership think of the potential program? What is the context or setting in which the program will be delivered versus the context or setting that was delivered in the randomized control trial? How realistic is the program dosage? Dosage means the number of sessions, the duration of sessions, the length. Does the implementing organization have the staff capacity necessary to implement the program with fidelity? What is the level of effort? What are the qualifications of people in order to implement the program effectively? What is the comfort level of people in the organization about, and related to this program? What is the training that they have received? Does the implementing organization have the leadership capacity necessary to implement the program with fidelity? Does the implementing organization have the fiscal, resource, and technical capacities necessary to implement the program? For example, do they have a training space, transportation, computers, software, manuals? Do they have notebooks? Do they have incentives? Do they need incentives? Do they have AV equipment? The third point is to assess the fit with the stakeholders. Stakeholders are groups in the community that either have a leadership position, could be even government, could be a congressman, could be a senator, could be a principal in a school, or they may be the residents of the community, not necessarily people that are going to receive the program, but perhaps community leaders. And some of the questions that we can ask ourselves is another group already implementing similar efforts? What is the level of readiness for youth and the community? Who are the key stakeholder priorities? Or what are? Consider adaptations to improve fit. Will the potential adaptations maintain the program's core components so the program can be implemented with fidelity? What materials or information is needed to make the potential adaptation? And the fourth point is to narrow the list of potential programs and select a program that fits. So for that, we need to reconsider each program with information gathered in steps 1 to 4, narrow the list based on information to determine most appropriate fit, and select a program that really fits based on criteria set in these first 3 steps to implement with fidelity.